Hello and welcome to Health Live at Seniors Today. We are today on April 1. It's All Fools Day. And we're discussing an issue which has been kind of teasing us for the last 3 years. And, given the number of cases that we've been having of H3N2 and influenza and COVID cases, we thought it would be good to have a special edition on this. In the past as well, we've been having a lot of sessions on COVID readiness. We've had some of the best internal medicine and emergency doctors from across the country on our show. And today we have Dr. Sohini Sengupta. Dr. Sohini Sengupta is the medical laboratory director at Redcliffe Labs in Delhi. And she's the head of the Department of Clinical Biochemistry and Special Assays. He's an MD and a DNB in clinical biochemistry and FNB in laboratory medicine. She is a corresponding member from India on the IFCC committees on POCT and laboratory errors and patient safety. She's a green belt in Six Sigma processes. She has published her research work in national and international journals and is an invited speaker on various platforms. It is our pleasure to have Dr. Sohini Sengupta here. Welcome to Health Live at Seniors Today.
Thank you, Dr. Pradyuman, for the nice introduction.
And H3N2 and various other new names that we keep hearing about. Is this all a source of worry?
See, right now, there is a mixed bag of things that's going on. Over the last 3 years, it's mostly been COVID. But, around this time of the year, it has always been a prevalence of influenza, what we more commonly call seasonal flu. So right now what we are having is a mix of influenza, that's the seasonal flu, then also COVID-19 simultaneously. When I speak of influenza, what happens is influenza has different strains. And of course, you might be knowing that, they are viruses. So they continuously undergo a lot of reassortment, what we in medical terms call mutations, and therefore come up with new strains every time. A new strain that's happening around is the H3N2, but it's also a type of influenza. So it's basically influenza A, H3N2 that's happening side by side. COVID-19 has also shown an uptick over the last few weeks.
What are the early signs that you see right now?
If you talk about the symptoms in general, it's very difficult to differentiate between COVID symptoms and influenza symptoms. So my first advice to people would be not to worry overtly, but at the same time, take adequate precautions. If you look at the general symptoms, most of them would be common. They would be fever, a bit of body ache or severe malaise, then cough, sore throat, sometimes running nose, along with vomiting as well as diarrhea. So these are the symptoms which might happen in COVID, which might again happen in an influenza or H3N2 affliction of a particular patient. Having said that, in COVID, what we saw over the last 2 or 3 years was a loss of taste and smell. Now, loss of taste is probably still there, but not so much of loss of smell. But that again cannot be taken as a differentiating factor, because often what happens is people who are having seasonal flu tend to pop antibiotics and end up having a loss of taste as well. So if you look at symptoms, you cannot differentiate clinically too much on the basis of symptoms between COVID and H3N2. But the precautions that we need to take are, be very careful, because while on influenza, in case of influenza, it tends to affect children less than 8 years and those more than maybe 60 or 65 predominantly. COVID-19 tends to affect all age groups, including young adults as well. But in both the cases, and particularly in case of COVID, there's a possibility of it getting complicated even more, ending up affecting the lower respiratory tract, then, causing a lot of respiratory distress, breathlessness, etc., which is not so much of a symptom or a complication of influenza, except for the compromised ages, like very young children or very elderly. Because what we are seeing in the health advisory from the Ministry of Health and Family Welfare as well, about 92% of patients with H3N2 are also developing fever as the first symptom. Then around 85 to 86% are having cough. Around 27% only are having breathlessness. So these are more of a statistical analysis, but that is what is being given in the health advisories also, that, do not neglect a cough or maybe a fever. So I think it's very important that we do not take over-the-counter medicines and just treat them ourselves, but definitely seek a consultation.
Tell me, in terms of if one doesn't have all of these things, but how do you just ward off the threat? So obviously the good old things of masking up,
Yes.
N95 masks, hand hygiene.
Yes.
What else? Avoid crowded places. But life has got back to normal.
I know life has gone back to normal, and I was just traveling. I came back day before yesterday. So in the airports again, you see people are not wearing masks. So of course, life has gone back to normal. But I think particularly for people in the elderly age group, so I would say maybe 60 or above, particularly 65 and above. Then again, young children should take more precautions, should start, and in general, people should probably start masking up a bit, wear masks, particularly in the crowded places. Maybe not when you're sitting in a room, 2 or 3 of you at a distance. In the COVID times, we were wearing masks even at that point of time. But I think probably as a precautionary measure, it makes sense to wear masks in crowded places. Then because influenza as well as COVID-19, they tend to spread through aerosols. So that is respiratory droplets. So it's very important to wash your hands frequently, sanitize your hands, then cover mouth and nose while, coughing or sneezing, then to take plenty of fluid. That's very, very important.
We have a host of holidays and people are going to go holidaying and, short vacations, etc. Is that something that you would recommend at all? Travel?
I think right now there's no advisory against traveling because, it has been restricted. I mean, the number of H3N2 cases are also restricted to around 6 to 7 states as of now. But of course, for ourselves, even I don't think we should go back to the COVID times immediately. But for ourselves, even if we are traveling, like I said, use mask when we are in a crowded place. Then if we are traveling to some other place, we continue to wash our hands or at least sanitize our hands, use masks wherever it is possible. I think these are small steps which would really help us, just protect ourselves.
Doctor, we have quite a few questions that have come in, so I'm going to take them. So there's one from Mr. Brish Duggal, who's 78.
Yeah.
He's taken the influenza vaccine 22, yes, and he's now being told to take a vaccine for 23.
Yes.
It cost me 1,800.
Okay.
What is the system distribution of influenza vaccine? And is it possible to take it from government agencies? Obviously, every year you have this vaccine and you have people who are retired and who are living off their savings. Are there facilities, are there government agencies which will be giving this at a lower cost?
See, I'll tell you why we need to. First, I'll just come to this point, why we need to take influenza vaccines annually, like compared to a lot of other vaccines which we maybe taken when we were younger and never repeated it later. So that is because, like I said in the beginning of this discussion, that influenza virus undergoes a lot of mutations. So the strains keep changing continuously. The World Health Organization has this body which continuously monitors the influenza virus that's happening. It was H1N1, so then now H3N2. So, and there are many others in between also, which we really don't get to know of. So what they do is they regularly update their directory and the genomic variation of these particular virus, and accordingly give advisories to update the vaccines as well. So that's how, and these vaccines have a very short, impact on our life. Within a period of few months to a year, the antibodies start to wane off. So that is why it is very important that even, a particular influenza vaccine or particular vaccine, influenza vaccine, may not be exactly matched to the strain that's going around, but still it helps. And particularly in younger people, even if it is not totally matched, it helps to have the vaccination done, because it will provide a whole lot of coverage. But in the senior citizens, what it does is it helps to prevent the complications, particularly the ones who have maybe a heart or a lung ailment, diabetes, or some other immunodeficiency disorder. These influenza vaccines go a long way in preventing long-term complications. So coming to his question, what I would like to say is, because it is not a part of the universal immunization program as adopted by the government of India, it may not be available through government agencies. But at the same time, if you are a beneficiary of some health scheme at your state or central level, you could probably be able to avail of it.
Right. So, Doctor, right now, we are in the year 23, and is there a fresh influenza vaccine that has come out this year?
Yeah, it is there. And basically what happened is, like I said, influenza has 4 different subtypes, of which influenza A and influenza B are the most common. And the ones that we talk about, like H1N1, H3N2, are all subtypes of influenza A. So previously what was happening is a mode of trivalent vaccines were available, which covered, influenza A, both the subtypes of influenza A as well as influenza B. Now we have quadrivalent vaccines as well, which would take care of both A and both B subtypes. So that's why, like I already mentioned, depending on what strains are going around in the environment, the WHO keeps updating itself, and the vaccine producing organizations also, adopt themselves and acquire these strains in the vaccines that they prepare.
Katie Dadanji, who asked, Doctor, are the nasal drops for COVID made in Hyderabad as effective as the COVID booster jabs? And are they, first of all, available?
See, they've all been tried. A lot of clinical trials are still going on. And I believe that, a lot of them have actually passed through the initial clinical phase trials and have been made available for use. But having said that, if you have already received 2 doses of vaccine and a booster dose, you really needn't go in for an over-the-counter nasal spray just like that. I mean, you still would be having antibodies in your body to combat an infection if it is of the same strain. So, just going for an OTC nasal spray by yourself without the advice of a doctor is not really recommended.
Doctor, I must tell you, I'm using this Suffer app just now.
Okay.
And the Delhi AQI, overall AQI, is 74.
Yeah.
All right. And what is it in Mumbai? In Mumbai, with all those construction happening, it is 86.
Okay.
Yeah. And in Pune, the AQI is 85. So Delhi, by the way, is perhaps has better air right now.
Yeah, probably it's probably because of the rains that's happened over the last few days. So that sort of clears up the air. I think that could have, but I mean, this is really good news from you, because 74 is really, I mean, amazing for Delhi by Delhi standards.
Dr. Sengupta, it was really good that you came in. I'm not asking all the questions right now, so many of them are similar.
With respect to the diarrhea, I'd just like to tell him
He
that,
has
of course,
mild fever. He had mild fever.
okay, so of course, we probably will not get more details, but what happens is, of course, diarrhea can be an accompanying feature with fever, both in case of COVID as well as influenza. But if it is not, if it is not improving, like I said, there's severe diarrhea, which is watery stool and all, he should supplement with oral rehydration medicines which are available. He should take plenty of fluid, because in senior citizens, the water loss tends to make them very, very weak and dehydrated, and it happens suddenly. So that's why that water intake, coconut water, oral rehydration salts, all of these need to be supplemented. Because it could be, or it may not be related to any influenza or COVID-19, or it may be also because he also had a bout of fever. And if it does not subside on its own, then definitely he should, consult somebody.
Thank you, Dr. Sengupta, for coming in at very short notice. We just felt that it's good to have somebody speak on this topic, and it was interesting to have somebody with your profile, somebody who is into medical, biochemistry and the like, which is a very growing area now. It was interesting. You put down all the facts, and you've mentioned about the need for an influenza vaccine. Those of you who can take it, please go ahead and do that. And there is need for taking care, for masking up, ensuring that you are not too adventurous. Perhaps ask your domestic help to start masking up. And when the domestic help is coming into your room for doing the jhadu, pocha, katka, whatever you call it, the sweeping and sopping, ensure that both of you are masked up. Yeah. And don't be too adventurous. We hope all of you are safe. I'm sure you will be safe. And we've done it all in the past. It's just a question of, it's another summer, and the summer of 23 should be as safe as the various summers before 2020. Thank you very much, Dr. Sengupta, for being here. Those of you who would like to attend the health webinars, you can pre-register so that you'll always be there on our database, and we will send you the registration link. We are always there on Saturday evenings at 5 p.m. You don't need to get a watch or a clock for yourself. If it's 5 o'clock, we are there on health webinar on a Zoom room near you. And we'll be there next Saturday, that is April 8th, for another session of Health Live at Senior State.
Thank you very much, Mr. Pradyuman. It was really a pleasure discussing with you. Thanks a lot for having me.
And all of them, as you saw, Dr. Sengupta, they're all senior citizens.
Yes.
And people of all age groups, right? 80, 65. There were just few who are 65. All of them are very old, and they are all very active on Zoom. Some of them are regular listeners, and okay. It's really heartwarming that you could answer all the questions that they gave.
Thank you. I hope they find it useful and it helps them.
Thank you very much.
Thank you. Thanks a lot.